Hello and welcome to Generational Wellbeing with Dr. Lum. Thank you for joining me here today, where I provide you with simple, practical tips on how to create sustainable, healthy habits for you and your family. Thank you again for joining me. Please like, share, and subscribe. So today I will be talking about postpartum depression. Did you know that 1 in 7 mothers actually experience postpartum depression? And of that number, only about 60% of mothers end up seeking help or getting some sort of treatment that is needed. So today I'm here to really bring awareness to the problem, because many more people actually experience postpartum depression than we know, right? Because it's this hidden issue where it's seen more as a moral issue as opposed to a medical issue, and it comes in with the mom guilt, the shame of not being there for your kid, or the guilt of I should be happy, I have this new baby with me, I should be this way, so that expectation does not match how you feel. So it's just like, oh, you don't want to talk about it. So today I'm here to really say that I see a lot of women and mothers, great mothers, who will go through this and don't feel comfortable with talking about it. So I'm here to say, no, it's not a moral issue, but it's a medical issue. And the earlier you come out and talk about it, the earlier you get help. It's going to be helpful not only for you, but also for your kids. So why does this happen? So two things, actually multiple things, right? The first thing is hormonal changes. Your body changes. There's so many hormones that will go up and down throughout your pregnancy. And towards the end, there's this drastic change in the hormonal system. And part of the area of the brain that really takes care of like the emotional regulation, there is a huge change in that area that when it's overly stimulated, it can lead to symptoms like sadness and hopelessness and just exhaustion and stuff. So that's the first thing. Second thing is there's this also another hormonal change where you have a high level of progesterone and estrogen, and then after the baby comes, all those levels drop back to the levels they were during pregnancy, and those sudden changes too will also cause the symptoms that you will see. And then furthermore, your body goes through a stressful period, right? I mean, you're pushing out this baby or you're going through a C-section. That puts a lot of stress on your body already. So with everything coupled up together, it just takes a toll on you. It's just like a recipe for disaster. So no doubt, so many people end up experiencing symptoms of postpartum depression. And I would say, just to clarify, there are some symptoms where you can feel sad, you have mood swings here and there after you have a baby. That's not considered postpartum depression. I'm talking about people or women who have these symptoms for more than 2 weeks, where you have symptoms like just hopelessness and sadness and anger or rage, or just you cannot connect with your baby. It's just like the baby's just sitting there just looking at this baby and you're unable to connect with them. And and you see sometimes too where they have thoughts of self-harm or even thoughts of hurting your baby. And we hear stories about that. Every now and then you hear a story in the news where a mother actually goes as far as hurting and killing their infant and themselves. And we'll look and listen to those stories and like, oh, what has come of today's society, but not stepping back to think that this may be someone who is actually struggling and either did not seek help because of the moral or the mom guilt or mom shame, or for other reasons, who knows, right? So if you're experiencing those symptoms, you want to make sure you seek help from your medical provider, either from your medical doctor or even your pediatrician, right? Most pediatricians now are actually screening for postpartum depression because of how prevalent the issue is. Okay, so what else can you do if you're experiencing postpartum depression? Exercise. I love exercise because what that gives you, especially if you have someone at home to sit with the baby for even up to 10 minutes, 15 minutes a day, that will help to boost your dopamine, your pleasure centers in the brain, and it gives you like that personal time away. It's like stepping away from the baby and like hitting a reset button, where it's just like you're exercising. It's my me time, it's my personal time. I'm hitting reset. I'm kind of out there in the sunshine, in the sunlight, because vitamin D is also helpful for that. So that usually helps kind of hit reset, and then you can come back and tackle the rest of the day. And second thing is sleep, right? Your sleep is disrupted. Everything changes because your normal sleep is disrupted. It doesn't matter how good the baby is, to the babies who cry like every hour. It's just like you're pretty much on call 24 hours, because the moment you try to fall asleep, that baby wants some more food. So really trying to make sure you're syncing your schedule with the baby's, in tone with the baby's schedule, because guess what, these babies did not read the manual, right? They didn't come in with certain set of expectations. They didn't read the manuals as in all of those parenting books. But this is a time where it's like hitting reset and really trying to figure out and get to know the baby, so that once you're connected and you can sync your schedule with baby's schedule, things become much more easier. And finally, nutrition. Nutrition is so important, because again, as we make our plans for the baby, we go out and buy baby clothes and baby's food and take care. Everything is about the baby, but we forget that we also have to nourish ourselves to be able to take care of the baby. A lot of times parents or mothers will forget to eat, because but between breastfeeding and or formula feeding and changing diapers and trying to clean up, it's like there's no time for you to really sit down and eat. So whether it's planning a week ahead of time, making your food, freezing it, and just having time to warm it up and eat, that's really important. Or having a bottle of water by your bedside, while when you're feeding you can take sips of water so you stay hydrated as well. And if you want to supplement, omega-3s are really good for brain health, so that would be a good one to do. And finally, do not forget to get help, because if you don't get the help you need early, again, long term, it may end up affecting not only your health and the baby, but also that bond and connection with the baby. I've seen kids who've ended up growing up and not having that connection with their parents, just because, not that the parents were negligent per se, but it's just they didn't have that urge within them to go ahead and make or form that bond and that connection. Again, not from a moral standpoint, but because again, that area in the brain that helps with that emotional bonding and connection is out of place, right? So it takes a lot of things, a lot to kind of overcome that. So that's why you need to get help. Oh, one last thing I forgot to add, the mindset, right? This is a time again where you have a lot of thoughts that are negative, that are you're bombarded with what other kids are doing at certain stages, and your kid is not doing that. And there's always that guilt of like, I'm not doing enough for my kid. My kid should be doing this. He's eating too much. He's crying too much. This is going on. But instead, trying to have that practice of gratitude, right? When your thoughts start coming in, I'm grateful my kid is healthy. I'm grateful my kid is here with me as opposed to being in the hospital. I'm grateful we made it through the end of today and you're still breathing. So really choosing to celebrate those small wins as opposed to look at the things that we did not do, because you have to take it one day at a time. Hope this was helpful. Leave comments in the comment box and let me know if there are other topics you'd like for me to talk about. Thank you for your time. I'm Dr. Lum.